counting carbs, watching portions, fitting in daily steps. Diabetes management already feels like a full-time job. Yet even the most disciplined plan can fall short if the body is missing key nutrients. Subtle vitamin and mineral gaps make insulin work harder, slow glucose clearance, and inflame blood vessels. Fill those gaps and the same eating and exercise routine suddenly works better. Below are 5 nutrients with the strongest research for supporting healthy blood sugar, calmer A1C numbers, and better long-term outcomes. Yule. Learn why each one matters. The top food sources and safe supplement tips to discuss with your clinician. Nothing here replaces personalized medical advice. Always confirm dosage with your healthcare team. Ds. Magnesium, the unsung insulin co-pilot. What it does: magnesium powers more than 300 enzymatic reactions, but its headline job in diabetes is helping the insulin receptor flip on. When magnesium is low, receptor doors half close, glucose lingers in the bloodstream, and the pancreas has to pump out extra insulin, a recipe for rising resistance. Proof on paper. A 2021 meta-analysis in Nutrients combined data from 24 trials. Volunteers who raised magnesium intake cut fasting glucose by an average 10 micrometers dl and improved HOMA-IR, an insulin resistance score, up to 25%. Long-term observational studies show people in the highest magnesium quartile have up to 37% lower risk of developing type 2 diabetes. Best plate sources: spinach, Swiss chard, pumpkin seeds, almonds, black beans, quinoa, 70% dark chocolate. Supplement smartly. Most adults need 310-420 mg per day. If blood tests show you're short, magnesium citrate or glycinate, 200-300 mg at bedtime, absorbs well and is gentle on digestion. Avoid mega doses. 500 mg can cause loose stools and interfere with certain blood pressure meds. Vitamin D, sunshine for cells that make insulin. What it does: vitamin D acts like a hormone, docking on receptors in pancreatic V cells to boost insulin production. It also tempers chronic inflammation, a hidden driver of insulin resistance. Proof on paper. An 8-year follow-up of 4,000 older adults in diabetes care found those with serum vitamin D above 30 ng/ml were 36% less likely to progress from prediabetes to type 2. In randomized trials, supplementing 2,000 IU daily cut A1C by roughly 0.4 points in deficient participants. Best plate and lifestyle sources: wild salmon, sardines, pasteurized eggs, fortified milk, and 10-15 minutes of midday sunlight on arms, legs, without sunscreen when UV index allows. Supplement smartly. Ask for a 25OH vitamin D blood test. Levels 30-50 ng/ml are sweet spot. Many adults reach that with 1,000-2,000 IU daily. Take vitamin D with the fattiest meal for better absorption and pair it with 100-200 mcg vitamin K2 from natto or a combo pill to guide calcium into bones, not arteries. Is. Chromium, the trace mineral that tunes insulin sensitivity. What it does: chromium helps a small protein called chromogulin amplify the signal between insulin and the cell membrane's glucose transporter. Think of it as turning up the volume so cells hear insulin's knock at the door. Proof on paper. A double-blind study in diabetes technology and therapeutics gave 1,000 UG chromium picolinate daily to type 2 patients. Fasting glucose dropped 20 mg/dl and A1C fell 0.6 points in 3 months. Benefit varies. People low in chromium respond best. Those already sufficient may see mild changes. Best plate sources: broccoli, barley, grape juice, red wine vinegar, grass-fed beef. Soil depletion means foods provide less than decades ago. That's why deficiency is more common. Supplement smartly. Typical therapeutic range: 200-1,000 UG day. Take with meals. Picolinate or nicotinate forms absorb better than chromium chloride. Skip if you have kidney disease, unless your nephrologist approves. Vitamin E, antioxidant armor for arteries and beta cells. What it does: chronic high glucose spawns free radicals. that batter vessel walls and pancreatic tissue. Vitamin E, specifically mixed tocopherols and tocotrienols, neutralizes these radicals, decreases LDL oxidation, and supports flexible capillaries, especially in the eyes, kidneys, and feet. Proof on paper. A 2022 trial in clinical nutrition gave 400 IU mixed tocopherols to adults with poor glycemic control. Within 16 weeks, oxidative stress markers fell 30% and nerve conduction speed improved. Meta-analyses show modest but significant drops in A1C, 0.2 to 0.3 points, when vitamin E is combined with standard medication. Best plate sources: sunflower, seeds, hazelnuts, almonds, spinach, avocado, cold-pressed sunflower or wheat germ oil. Supplement smartly, stay at or below 200-400 IU per day, and choose formulations labeled mixed tocopherols, tocotrienols, not just synthetic alpha-tocopherol. People on blood thinners should consult their doctor first, as high doses can increase bleeding risk. Omega-3 fatty acids, anti-inflammatory fuel for metabolic health. What they do: EPA and DHA, from marine sources, calm the low-grade inflammation that underpins insulin resistance and endothelial dysfunction. They also lower triglycerides, another risk factor that rides alongside elevated glucose. Proof on paper. In the Origin trial, participants who took 1 gram of purified EPA-DHA daily saw a 16 mg/dL drop in triglycerides and a small but significant gain in insulin sensitivity after 6 months. A Japanese study linked high blood plasma EPA to a 43% reduction in progression from IFG, impaired fasting glucose, to type 2 diabetes. Best plate sources: wild salmon, mackerel, sardines, herring, and for plant-based eaters, chia seeds, flaxseed meal, walnuts, though ALA conversion. To EPA-DHA is limited. Supplement smartly, aim for 1,000 to 2,000 alums combined. EPA plus DHA daily. Check the EPA-DHA line on the label, not just fish oil grams. Pick molecularly distilled or IFOS-certified brands to avoid heavy metal contaminants. How to build your blood sugar support. Routine lab. First, pill second. Ask for magnesium, RBC, vitamin D, fasting glucose, A1C, lipid profile, and if possible, serum chromium. Let numbers guide dosage. Supplements are tools, not blanket insurance. Food over pharmacy. Create a daily plate. Half non-starchy vegetables, quarter lean protein, quarter high-fiber carbs, plus a spoon of healthy fat. Rotate magnesium and chromium-rich foods throughout the week. Pair. Nutrients for synergy. Magnesium plus vitamin D boost insulin action. Vitamin E plus omega-3s tame inflammatory stress better together than apart. Move and hydrate. Even 15 minutes of brisk walking after meals blunts post-meal glucose spikes. Proper hydration, plain water or herbal tea, helps kidneys flush excess glucose. Recheck quarterly. Track A1C, fasting insulin, lipid ratios every 3 to 6 months to see if your regimen delivers tangible progress. Adjust supplement doses down once optimal ranges are reached. Maintenance beats megadoses. Quick FAQ. Can I ditch my diabetes medication after starting these vitamins? A. No. Supplements support. They do not replace prescribed treatment. Always coordinate changes with your clinician. Q. Are multivitamins enough? Most standard multis contain minimal magnesium, often oxide form, low chromium, and only alpha-tocopherol for vitamin E. A targeted approach usually works better. Q. How fast will I see results? Magnesium and chromium may improve fasting glucose within 4 to 8 weeks. Vitamin D and omega-3 benefits often show on labs after 3 months. Consistency and overall lifestyle determine speed. The takeaway: better blood sugar isn't only about counting grams of carbohydrate. When the body has the right micronutrients, insulin works smarter, cells burn fuel efficiently, and inflammation calms. Start with a blood test, layer nutrient-dense foods, and use supplements strategically, never blindly. Do that, and the numbers on your meter and your next A1C check may shift in the direction you've been working toward. Which of these 5 nutrients surprised you most? Comment the number below: 1 for magnesium, 2 for vitamin D, 3 for chromium, 4 for vitamin E, 5 for omega-3s. If this helped, tap like and subscribe for more evidence-based guides on thriving with diabetes. Your path to steadier glucose and stronger health starts with the choices you make today.